Hello, students and my dear friends. In this session, we'll discuss one of the important central nervous system infection, that is meningitis. So, in this video, we'll discuss about like the definition of meningitis, types, pathogenesis, and clinical features. We'll discuss. So, what is mean by meningitis? So, meningitis means inflammation of the meninges. So, what is meninges? Meninges is the outer covering layer of the brain and the spinal cord. So, here in meningitis means inflammation of the membranes, such as leptomeninges, which is surrounding the brain and the spinal cord. So, in the picture, you can see like this is the normal meninges. So, and here it is like inflamed meningitis, you can see. So, you can see the like inflammation of meninges here. Meningitis, it is caused by viruses, bacteria, fungi, and even protozoa also. So, here the meningitis, so based upon the type of the organism, like where it is involved. So, as we discussed, it is caused by bacteria, viruses, and fungi. Suppose, like if the meningitis is caused by pyogenic organism means like pus forming organism. So it is like if the meningitis is of bacterial origin, like which means it is caused by pyogenic organisms, it is called as acute pyogenic meningitis. And even Mycobacterium tuberculosis also causes meningitis, that is called as tuberculous meningitis. So Mycobacterium tuberculosis and other pyogenic bacteria, so they are of bacterial origin. Okay. And next, second one is aseptic meningitis. So aseptic meningitis is caused by the viruses and even some of the bacteria. So what are those bacteria? So which are other than pyogenic bacteria. So other than like a pyogenic bacteria, like they causes like aseptic meningitis, and even the meningitis which is caused by fungi and protozoa, that is comes under aseptic meningitis. And next, tuberculous meningitis. So tuberculous meningitis, as we discussed, so it is caused by Mycobacterium tuberculosis. So it is as a part of aseptic meningitis. Suppose like if the infectious agent, if it is not identified, then it is considered as like a aseptic meningitis. So what is mean by aseptic? Which means there is no infection. But nowadays, like it is easy to identify the like infectious agents because we have advanced techniques such as molecular techniques. So by using of molecular techniques, we can easily identify the like organisms, either it may be bacteria or viruses, fungi, and even like a protozoans. So as we discussed, so meningitis, it is named as bacterial meningitis, viral meningitis, and chronic meningitis. So what is mean by chronic meningitis? So chronic meningitis means so the meningitis which is of more than like 4 weeks. Suppose if the patient suffer from the like meningitis for more than 4 weeks, that is considered as like a chronic meningitis. So chronic meningitis, it is mostly caused by the like viruses such as aseptic meningitis. So they include the most causative agents of aseptic meningitis, and still we use the like term aseptic meningitis in the clinical practice. So next, types of meningitis and etiology. So as we discussed, meningitis, it is mainly classified into three types. The first one is acute bacterial pyogenic meningitis, so which is caused by pyogenic bacteria, which means pus forming bacteria. And second one, viral meningitis, and third one, chronic meningitis. So if you see the first one, acute bacterial pyogenic meningitis, so it is caused by bacteria other than the Mycobacterium tuberculosis. So as we discussed, Mycobacterium tuberculosis causes tuberculous meningitis. So other than Mycobacterium tuberculosis, like Neisseria meningitidis or Streptococcus pneumoniae, Listeria, like all these comes under the like pyogenic meningitis. So pyogenic meningitis is like serious and fulminating type. So which means it leads to the like a serious condition in the patient and with like severe infection. And it is characterized by elevated polymorphonuclear cells in the CSF. So here, in case of meningitis, when we suspect the meningitis, we generally collect the like CSF sample. So so based upon the like biochemical analysis, so based upon this cell count only, we can classify the meningitis, whether it is bacterial meningitis or viral meningitis or like a tuberculous meningitis. So in case of pyogenic meningitis, we can see the elevated polymorphonuclear cells. So except for Listeria monocytogenes. So in case of Listeria monocytogenes infection, so the lymphocytes are predominant in the CSF. So here the lymphocyte count is increased in the CSF. And next, pneumococcal and meningococcal meningitis. So pneumococcal meningitis is caused by Streptococcus pneumoniae. Meningococcal meningitis is caused by Neisseria meningitidis. So they can occur at any age. So if you see Haemophilus influenza, so Haemophilus influenza causes meningitis in the children from 3 months to 5 years of the age. So that's what HIV vaccine, Hib vaccine, that is given in the form of pentavalent vaccine at the age of 6 weeks, 10 weeks, and 14 weeks. So to prevent from this condition also. So that's what we complete mostly like three vaccines before the like 3 months. And next, Listeria monocytogenes. So it causes infections in the immunocompromised host. Immunocompromised host means those who are having the like less immunity. So especially in case of like HIV infection or otherwise like other like immunocompromised conditions. Generally, Listeria monocytogenes causes infection. And next, Neisseria meningitidis. It causes potential, it means it causes severe diseases, which causes like outbreaks and epidemics. So this is the list of the like bacteria which causes like meningitis. So if you see the age group, neonates means newborns, means up to the age of 28 days, and infants. So what are the organisms causes infection? Group B streptococci, such as Streptococcus aglycitiae, Escherichia coli, Klebsiella species, Listeria monocytogenes, Haemophilus influenza, Streptococcus pneumoniae. And in children and in adults, so what are the most common causative agents? Streptococcus pneumoniae, so which is also known as pneumococcus. So Neisseria meningitidis, which is also known as meningococcus. Haemophilus influenza, Listeria monocytogenes. So these are the bacteria that causes infections in the children and adults. Next, viral meningitis. So viral meningitis is characterized by elevated lymphocytes in the CSF. So when we go for the like CSF analysis, we can see the elevated lymphocytes. So general like enteroviruses, they are the most common causative agents. Majority of the cases are caused by the like enteroviruses. And next, herpes simplex viruses are second most common causative agents. So generally, viral meningitis is like mild infection. So what are the causative agents of acute viral meningitis? So as we discussed, so enteroviruses, they are the like most common causative agents like poliovirus, Coxsackie virus, and ecoviruses. Next, herpes viruses such as HSV2, herpes simplex virus 2, varicella zoster virus. So generally, varicella zoster virus causes chickenpox, and EBV, which means like Epstein-Barr virus. And next to paramyxoviruses such as mumps virus and measles virus. And next to arboviruses such as West Nile virus causes the meningitis. So arboviruses, they are transmitted by arthropods as vectors. They are transmitted by the bite of the arthropods. Next, chronic meningitis. So what is mean by chronic meningitis? So there is inflammation of meninges, which is more than of 4 weeks. So the patient suffer from the meninges for more than of 4 weeks. So in case of like a CSF analysis, so we can see the predominantly elevated lymphocytes and even elevated neutrophils in the CSF. So it is observed in some cases. So chronic meningitis, it may be caused by either bacterial or fungal or parasitic infections. So fungal meningitis, it is mostly seen in the immunocompromised patients, and chronic meningitis, this occurs by the non-infectious causes. So they may causes by non-infectious causes such as some of the drugs or toxins or like any chemical substances. They causes chronic meningitis. So what are the causative agents of chronic meningitis? So bacteria, such as Mycobacterium tuberculosis, this is the most common causative agent, and Borrelia burgdorferi, Treponema pallidum, Leptospira interrogans. So these are the bacteria causes chronic meningitis. Next to fungi, such as Cryptococcus neoformans. So this is the most common causative agent. So it is present in the like birds, especially in the like pigeon droppings. Next, Candida albicans, Histoplasma capsulatum, Blastomyces dermatitis, Coccidioides immitis. So these are the fungi which causes infection. And next to parasites such as Toxoplasma gonadi, Naegleria species, and Acanthamoeba species causes chronic meningitis. Next, recurrent meningitis. The word itself it suggests recurrent, which means there is multiple acute episodes of meningitis. So there is like the patient suffers from like meningitis like again and again. So which is of less than 4 weeks in a duration. Pathogenesis. So how this bacteria or how this viruses they causes the like a meningitis. How this particular microorganism causes meningitis. So how they enter. So the first like a hematogenous. So they may enter by hematogenous route or direct spread, or in case of any anatomical defect, or they spread along the nerves. So if you see the hematogenous route, so hematogenous route is the most common route. So what is meant by hematogenous route? So the microorganism enter into the bloodstream, either bacteria or virus, they enter into the like bloodstream, and along with the bloodstream, they reaches to the like brain and they causes the like meningitis. So this is the most common route. So here the bacteria or virus, so they enter by the like nasopharynx. So the causative agents enter by the like nasopharynx, so or oropharynx. So once the bacteria or virus they attaches to the mucous membranes of nasopharynx or oropharynx, they undergo the like multiplication, or in case of virus they undergo the like replication, and from there they reaches to the like a bloodstream, which means the organism enter into the bloodstream and it develops bacteremia and viremia. So what is mean by bacteremia? Bacteremia means presence of bacteria in the bloodstream, or viremia, viremia means presence of virus into the bloodstream. So once the bacteria or virus enter into the bloodstream, so these organisms enter into the subarachnoid space, either through the chordae plexus or through the other blood vessels of the brain. Next, direct spread. So sometimes the microorganisms they directly spreads to the like a brain from the infected states, such as middle ear. Suppose if the patient is already having the like middle ear infection, such as otitis media. So what is otitis media? Infection of the middle ear, or otherwise in case of mastoiditis, or otherwise if the patient is already having the like sinusitis, or from the nasopharynx also directly the bacteria or virus enter into the like brain. And anatomical defect. Suppose if there are any anatomical defects in the central nervous system, okay. Suppose in case of surgery, or otherwise during the like surgery, or otherwise any trauma, such as in case of severe injury, or otherwise congenital abnormalities. By birth only, if they have any abnormalities, then the microorganisms enter into the like brain. And next, spread along the nerves. So spread along the nerves is the like least common route. So this generally takes place in the like rabies virus. So as you know, in case of rabies virus, so rabies virus is transmitted by the dog bite. Initially, the virus enter into the peripheral nervous system. Once they multiply, they reaches to the like a central nervous system. It is little bit a slow process. So this rabies virus it travels through the like through nerves to the central nervous system, and another one is the like herpes simplex virus. So these are the like routes of the infections. But here we have blood brain barrier. So what is this blood brain barrier? So it is a special structure or unique structure. So this blood brain barrier it minimize the passage of organism into the like CSF. Okay. So then how the meningitis develops that depends upon the host microorganism interactions. Next, predisposing factors. So what are the factors contribute for the like a meningitis? So the first one is age, next vaccination, and third one factors that predispose infection at other organ system, and fourth one prosthetic devices, and fifth one blood brain barrier breakage, and sixth one virulence factor. If you see the first one age, like neonates, so which means newborn, they have the higher incidence. So here, why the neonates they get the like infections easily, meningitis easily, because their immunity system is immature and there is increased permeability of blood-brain barrier. So that's what there are more chances of getting the like a meningitis. And generally, the neonates they acquire the like infections from the mother's vagina. So especially in case of streptococci and in group B streptococci and in case of Escherichia coli. So these organisms are transmitted from mother's vagina to the like newborn. So during the like birth it takes place. And even very young children and very old age persons are also like more prone to the like meningitis. So even in the like young children also the immunity system is in the like a developmental stage or in the constructive stage, and in the old age people there is gradual waning or gradual decrease of the like immunity power. Next, vaccination. So, like if you give the like a vaccination, automatically the incidence of meningitis is decreased. So generally, HIV vaccine is available, Hib vaccine is available. This gives protection from Haemophilus influenza. So it is given in the form of pentavalent vaccine. And next to pneumococcal vaccine, so that is PCV, pneumococcal conjugate vaccine. So this vaccine gives protection from some serotypes of the Streptococcus pneumoniae. And next, factors that predispose infection at other organ system. So as we discussed, so respiratory tract, it is a primary site of entry for many of the causative agents. So generally these organisms enter by the like inhalation. So once they enter by the like inhalation, so they attaches to the like respiratory tract and they colonize, and it leads to the like development of the like meningitis. So other factors such as diabetes, alcoholism, splenectomy, and immunosuppression. So they also contribute for the like meningitis. Next, prosthetic devices, which means like artificial devices. So the patients who are having the like prosthetic devices, such as CNS shunts, so they are at the risk of developing the like meningitis. And next, blood-brain barrier breakage. So as we discussed, we have blood-brain barrier, okay, so which minimizes the passage of organisms. So in this case, so in sometimes the organisms they enter into the central nervous system by breaking down the like a blood-brain barrier at a microvascular endothelium. Next, virulence factors. So some of the organisms, especially the bacteria, they have the like virulence factors. So they contribute for the development of the meningitis. So if you see in case of capsule, so what is capsule? So capsule is the outer gelatinous layer which is secreted around the cell wall of the bacteria. So if you see in case of Haemophilus influenza or Streptococcus pneumoniae, they possess the like a capsule. So as this capsule is present as a like a outer gelatinous layer, so it to protect the bacteria from the like to escape from the like phagocytosis. So what is phagocytosis? That is engulfment of bacteria by the like phagocytes such as like WBC. So in this case, so actually the phagocytes should engulf the like a bacteria. But in this case, what is happening? As this bacteria is having capsule, they escape from the phagocytosis. Next, IgA1 protease. So generally, IgA antibody is the like a local antibody. It to protect the mucous membranes against the invasion of the like microorganism. So here, if you see some of the bacteria, they produce IgA1, IgA proteases, such as Haemophilus influenza. So this IgA proteases destroy the like a IgA antibody. Actually, IgA should destroy the like a bacteria, but here the bacteria is only producing IgA protease, which will destroy the like a IgA antibody. So when IgA antibody is like destroyed, so it facilitates the attachment of bacteria to the epithelium. Next, clinical features. So generally the patients who have the like meningitis, they have the like symptoms such as fever, vomiting, severe headache, photophobia, which means fear of the light. So they can't see the like light directly, convulsions, and alteration of mental status. So, what are the signs of meningeal irritation? So, what are the signs what we can observe in the like clinical setup? So, we can see the like neck rigidity. So, severe neck rigidity we can see in the patients. And the important one is the Kernig's sign. So, what is the like a Kernig's sign? So when the hip is flexed at 90 degrees, so the leg cannot be straightened because of the severe stiffness of the hamstrings. So this is called as like a Kernig's sign. So whenever we try to like flex the like hip to the like 90 degrees, so this leg cannot be straightened. And next, another one is the like Brudzinski's sign. So what is this Brudzinski's sign? So here, if you see in this picture, whenever we try to flex the neck, so when the neck is like flexed, so because of the severe stiffness, so automatically the patient they lift up the like hips and knees. So we can see the like spontaneous flexion of the like hips and knees. So whenever we try to raise the like neck, automatically the patients or the children they show the flexion of the like hips and the knees. And in case of neonatal meningitis, so in case of newborns, so we cannot see this Kernig's sign and other signs. So, but generally the baby is unwell and baby is not feeding well and vomiting we can see. Thank you. So in the other session, we'll discuss about laboratory diagnosis and treatment strategies we'll discuss. Thank you.